Let's talk about the relationship between magnesium and mitochondrial integrity.
There are 1 to 2,000 mitochondria in every cell. There's more in the heart because the heart needs the energy. And red blood cells don't have mitochondria, which, sidebar, we're doing instead of a sheer magnesium test, which is completely irrelevant to what's going on in your cells. People and I recommend a red blood cell magnesium because we can't get the ionized magnesium test. I'm doing university research studies to show the importance of ionized magnesium. But here we're doing this red blood cell magnesium test, and there are no mitochondria in there, which means the level of magnesium is going to be low. So that test is a bit, sketchy. So for mitochondrial health, like I said, the pyruvate cycle and then the Krebs cycle absolutely are geared to the amount of magnesium that you're taking in. If you're not getting your RDA, and the RDA is set low, 300 to 400 milligrams, we need at least 600 milligrams. Like I said, I had to take 1,200, but then after I got saturated and all my symptoms were gone, seriously, in my mid-70s now, I feel better than I did in my 30s because I'm saturated and my body and my cells are working properly. So if you get saturation, then at this point in time, I'm only on 450 milligrams a day of magnesium. If I take more, I'll get the laxative effect because my body doesn't need that much. Now, I know I drifted away from mitochondria, but what specifically do you want to know about mitochondria and magnesium?
Well, obviously we know the mitochondria produce all the energy. And so for the mitochondria to function at their best, clearly we need that magnesium there. And I didn't know if there was any extra information you had that you hadn't shared earlier.
What happens in the mitochondrial research, more in the alternative medicine, they talk about coenzyme Q10 as being important in the Krebs cycle. And it is. It's toward the end of the Krebs cycle. And it came into more prominence because of the overuse of statin drugs that kill the enzyme that makes cholesterol and regulates cholesterol. Right. So this statin drug also kills the HMG-CoA reductase enzyme that magnesium balances. So magnesium works with this same enzyme that statin kills. And if you need more cholesterol, magnesium will go to work. If you've got enough cholesterol, magnesium will pull away. And we make 80% of our cholesterol. It's not so much a dietary thing, but it is the regulation by magnesium that's important. So anyway, if you're taking a statin, you really should be taking coenzyme Q10. But if you realize that magnesium
and statins deplete magnesium as well, they're another magnesium depleter.
Absolutely. And I think it's the Lipitor statin has a fluoride molecule in it. So not only do you need to take more magnesium when you're taking these drugs, but also if you can understand that magnesium is a natural statin, as said by many researchers now, maybe a person could, with their doctor, wean off their statin drugs.
Yeah. And it's also, magnesium so critical for neuronal stability of the neurons, right? Like some of the most common symptoms are anxiety, depression, irritability, anger, cravings, a lot of these kind of neurological types of symptoms that are associated with magnesium deficiency. And so let's talk a little bit more about kind of the mechanism there. Obviously, when we look at neurons, they're the most dense cells with mitochondria. And so the mechanism there for magnesium deficiency associated with a lot of these neurological mental health type symptoms.
Right. Same thing. The magnesium opens up the neuron, the calcium goes in, fires an action potential, and then the magnesium pulls the calcium back out. When you have head trauma, that disrupts the whole, function of the brain, and the inflammation starts and the cells are wide open. Lots of calcium comes in. If you can give someone with head trauma a good, IV dose of magnesium or non-laxative type of magnesium, such as I work with, you can prevent these post-traumatic head injuries. It's that simple. And that work was done by the Burton and Bella Altora, and they forwarded my Magnesium Miracle book. These were two researchers, and they're still around, but by the time I got to them in the late 90s, they'd already written 1,000 papers on magnesium. And they promoted the ionized magnesium test. So that, we're 25 years later, and we still don't know about the ionized magnesium test. And when I approached them to do the forward, I was told by everybody else, oh, they're bench researchers. They won't have anything to do with clinical magnesium. When I got to them, they said, we're fed up. We have been working for decades trying to get magnesium recognized, and nobody's opening up. Clinicians aren't opening up. I mean, they must have realized that medicine and big pharma were kind of in cahoots. So they forwarded the book, and since then they've done some incredible studies on aging, for Pete's sakes. They've found that magnesium disrupts the way the telomeres at the end of the chromosomes, the way they unravel. Magnesium stops that. So it's an anti-aging. And magnesium will dissolve calcium that's building up in tissues in the wrong places. So we've got, the calcification caused by women, especially being told they have to take 1,200, 1,500 milligrams of calcium, and ignoring magnesium entirely. So we've got a calcified society. We've got foods that are fortified with calcium. So our diet is like 10-to-1 calcium to magnesium, whereas we're born for more of a 1-to-1 ratio. I say 600 milligrams of magnesium, 600 milligrams of calcium. Calcium is so important for the body that it is well absorbed from food. I can eat a quart of yogurt over a 2-3 day period, and my heart palpitations will come back a little bit, because the magnesium is trying to push the calcium into bones and teeth and keep it from being in the blood. What does calcium do in the blood? Among other things, it's a blood clotter. It's actually a blood clotting factor. So if you have high calcium levels, you're going to be clotting, you're going to have soft tissue calcification, breast tissue calcification. DCIS is breast tissue calcification, Hillsbough's, gallstones, kidney stones, and atherosclerosis. Atherosclerosis, I mean, there's at a bifurcation of a blood vessel, you've got a vulnerable little V connection there. And if you don't have enough collagen, which is produced by your vitamin C processing, then you'll get little tiny tears and rips. And what does the body do? It puts a little plug of cholesterol on that rip to help it out. But then if you've got calcium in the blood, that calcium will precipitate on that cholesterol. You get a cholesterol plaque, and everybody says, oh, high cholesterol, that's the problem.
Yeah, the most of those plaques are mostly calcium, right? That's a key part. It's basically scar tissue forming in there, and calcium is a key component with that. Now, you were talking about calcium metabolism, how important that is, and magnesium plays a key role with that. Also, vitamin D and vitamin K2, and they kind of all work together, right?
Vitamin D is not activated unless you have enough magnesium. So all these vitamin D studies, it's a miracle. No, it's a crock. It's because when they do their research, they're not looking at the magnesium component or measuring the magnesium in these people. So if if you if you even go out in the sun and get a tan or a burn or whatever, you can actually, if you don't have enough magnesium
Yeah.
to allow the sun to work with the cholesterol to make your vitamin D. And then if you don't have enough magnesium, you can start getting magnesium deficiency symptoms. Also, this craziness of allopathic medicine, all of a sudden getting on the vitamin D bandwagon and giving people 50,000 units of vitamin D2, that
Right.
has really, in some people, they'll come back to me and say, oh my gosh, all my magnesium deficiency symptoms are gone. What's going on? And I got to the point, the first question I said, did you start taking more vitamin D? And I mean, to us, it's obvious what's going on, but to allopathic medicine, I don't know what they do with people like that. They just, pat them on the head and say, well, come back when you're worse.
Yeah, yeah. I mean, so vitamin D is key, but you want to make sure you got magnesium on board. That's key, and they work together to take the calcium out of the bloodstream, appropriately putting it into the bones, all the different tissues of the body. So yeah, they work hand in hand, and we find it in nature. Like you take something like, like for example, egg yolk. Egg yolk has got magnesium in there. It's got vitamin D, vitamin K2. It's all right in there in nature. So when you're consuming that, you're getting all of it together.
But David, look what they did to egg yolks. They told
They
people they're
demonized it.
high in
Yeah, sure.
cholesterol, and started giving people egg whites to
Mm.
eat. I mean, it
Yeah,
boggles us all the
backwards.
time. Yeah,
Yeah, definitely
yeah.
backwards. Definitely not the best approach for sure.